Dental implant. Implant surgery is performed when the decision is made to replace one or more missing tooth with dental implants. The implant site is first prepared by making an incision in the gum to expose the bone. The bone is then tapped to create a space for dental implant using an assortment of drills. The space is gradually increased and tapered. A titanium implant fixture is then inserted into the prepared space. When completed, the surgeon will place a healing cap over the implant and stitch the gum tissue back to place. Before the dentist can seat any crown on the implant, time must be given to the bone to grow around the implant and anchor them securely. This healing process takes about 3 months in the lower jaw and about 6 months in the upper jaw. On the next visit, the crown will be ready for permanent placement in the implant fixture.